Good morning, everyone. Good morning, good morning. I'm Margaret Lowe, as you just heard. I am president of Atlantic Live. We are the team that brings the Atlantic's journalism to life on stages like this one across the country, and we are so happy to be back in Boston. It is a hub for brilliant minds and a home to world-class research institutions, hospitals, biotech companies, physicians, scientists, and entrepreneurs. And I am so delighted to welcome you to the third edition of Pulse. This is our annual summit on healthcare, so welcome. The work that unfolds in this city is felt across the country because everybody cares about healthcare. No doubt it will be a hot topic in the 2020 election. A majority of voters said healthcare was the issue they cared about most in last fall's midterms, ahead of immigration or the economy. And a recent Gallup poll showed that most Americans think that this country's healthcare system is in a state of crisis or has major problems. And we all know that Americans spend far more on healthcare than any other developed country in the world, but that has not translated to better outcomes. Where you were born, where you live or work, and where you go to the doctor all play a role in determining their health. With that backdrop, we felt it was the perfect moment to explore possible fixes for America's healthcare systems. And fixes is our theme for today. And among the fixes we'll explore how to ensure that fewer women die during pregnancy or childbirth, how to improve healthcare for those who've been marginalized, or how to solve medicine's Me Too problems. And we have our very own fixer, Erica Chung, the woman who blew the whistle on the Silicon Valley startup Theranos, is our closer this afternoon. We're also attempting a small fix of our own today. We are always looking for ways to engage our audiences in the most meaningful way. So we're actually going to try something new, and you can let us know if it's a good fix or if it's not a fix at all. We're going to actually take a quick poll because the first thing we want to figure out is actually who is here in the room with us. This requires a cell phone. I suspect most of you have one. So if you'll indulge me, take out your cell phone. Everybody got their cell phones? And open a browser. And then type in Slido. That's slido.com. Once again, it's slido.com. Has everybody got that? Okay, good. Next, where it says enter code, type Atlantic Pulse. It's one word. And on your screen, you're going to notice two options at the top. Everybody see the two options at the top? Questions to the left, polls to the right. We'll be using both features today. Let's start with polls. So tap on polls. And we're going to answer the first question together. Your results will show on the screen, but this is all anonymous, by the way, so you don't have to worry about your name showing up anywhere. The first question is this: where do you fit into the healthcare ecosystem? Are you a healthcare provider, a physician or nurse, for example, a hospital administrator, an insurer, a patient or caregiver, an academic in biotech or the pharmaceutical industry, or other? We have mostly others in the room today. I'm delighted to meet all of you others. I can't wait to figure out what and who you are and what you do. In any case, no doubt we have a very interesting mix, clearly lots of expertise in the room, and no doubt many perspectives, so this promises to be a lively day. All right, we're going to try another question. Do you think that our political leaders in Washington understand the healthcare system enough to fix it? That wasn't even the laugh line. You're sort of foreshadowing how you're going to come out on this. Your choices are absolutely, yes, for the most part. They need a serious tutorial. I'm not looking yet. Or it's hopeless. All right, so not optimistic, not pessimistic. You think learning and education is an important thing for our elected officials. And this gives us some context for today and for our very first guest. So we're going to be using this technology throughout the day. I hope you enjoyed our first little go-round, including for questions and answers, and we're going to leave time for your questions after each session. And we also hope you'll join the conversation on Twitter at Atlantic Live. You can use the hashtag AtlanticPulse. And you'll also notice that there are small toys on the table. This is to help you focus and make this a stress-free and mostly enjoyable day. I'm not sure there's really good science to back this up, but just go with us and enjoy the toys along the day. The coffee will continue to flow, so don't be shy about getting up for a refill. And before we introduce our first session, I want to take a moment to recognize those who made today possible. And they are Philips, Bristol Myers-Squibb, Eli Lilly and Company, and CareMore Health. Today would not be possible without their support of our journalism, and we are enormously grateful. Can we please give our underwriters a round of applause? And another huge thank you goes to our collaborators at STAT, the news organization based here in Boston that reports on the frontiers of health and medicine. And we love conspiring with our colleagues at STAT on this event. Here's to STAT. Thank you. We have a very full day ahead of us, so we should get rolling. And we'll begin with a wide-angle lens. It's a conversation about the road to comprehensive health reform. And for that, I'm so delighted to introduce Dr. Zeke Emanuel. He's an oncologist. He's also Vice Provost for Global Initiatives and Chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania. Hello, Dr. Emanuel. Many of you may know him as one of the architects of the Affordable Care Act. And here to lead the conversation is my colleague, Atlantic staff writer, Van Newkirk. Van?